Hi y'all, my name's Emily, and for my occupation this summer, I chose to learn Spanish. I chose this language because in my job as a medical assistant at an ophthalmology office, I've noticed that a lot of my patients who don't know English, their native language turns out to be Spanish. And this language barrier can cause some difficulty in my ability to form a deep connection with my patients. And it can also prevent me from collecting all the necessary information that I need before the physician comes in. During the summer, we had a discussion where we watched a video called Cultural Competency for Healthcare Providers. In this video, it showed me just how different medical offices around the world are. It went through the situation where somebody had just moved to America and their husband had died, and she just didn't know what the appropriate behavior was in a medical office. And something I think that could really help somebody in this situation is if the person taking care of them greets them in their own native language. That familiarity might be able to help relax them and give them the comfort they need in order to ask for the help they need at their appointment. Also, by learning Spanish, even with an interpreter in the room, I may start to understand some of what the patient is saying directly rather than hearing it from a middleman. In one video for one of our discussions, the same week, but a different video that week, we watched, it said incompetent versus competent care. And we watched it and it talked about advocating for the patient's ability to self-determination and self-expression in however they feel best. I actually experienced this either last week or the week before at my office, where a patient came in with her son and her son was adamant that she did not need an interpreter for the appointment because she was trying to practice her Spanish. But I could kind of read her body language, and I decided to get the interpreter anyway. And later during the appointment, when her son went to the restroom, or he wasn't in the room, I'm not sure why, but he left the room, the patient actually thanked me for grabbing the interpreter because she felt more comfortable articulating what was going on with her vision with an interpreter in her native language rather than practicing English. So when learning Spanish, so this actually brings me to one of my goals when learning Spanish. My first SMART goal was to be able to have like conversational Spanish with my patients before grabbing the interpreter, so that I could introduce them to what's going on at their appointment right off the bat and hopefully make them feel a little more comfortable. Before I move on to the rest of my video and talk about my SMART skills and everything, I want to go over my schedule with y'all that I used when learning Spanish this summer. I did a 7-day-a-week schedule. The weekends were pretty light, but I just felt like I needed that routine. So Monday through Friday, like set in stone, I did 15 minutes a day of Duolingo. This helped me learn some basic communication, and I really enjoyed the game format of the app at the beginning, especially because I had that free trial with unlimited lives. I didn't feel, though, it helped me as much with physically speaking, but it definitely helped me with the writing and reading part of it. And then on Tuesdays and Thursdays, these are the days that I had class, so I felt like my schedule was a little lighter. I would watch at least 30 minutes a day of Hola Spanish videos. Her videos were about like 5 to 15 minutes in length, so I would watch however many I needed. Some days I would even hit more than 30 minutes. These videos were much more helpful in the pronunciation and communication aspect because some of her videos weren't just focused on vocabulary, but rather like how to pronounce different sounds with different letters in the words. And then 7 days a week for about 10 minutes a day, I would listen to Spanish Podcast 101. And this is something I would do more passively while running errands or driving. And these podcasts were pretty short, so I would typically just listen to 1 or 2 a day most of the time. And they were easy to cue, and I actually found a little like set playlist. Like I listened to them chronologically in order so that they kind of progressed in nature the more I listened to them. So now I want to talk more about my SMART goals. My first SMART goal was I want to be able to hold a conversation with my patient at the beginning of their appointment before grabbing our interpreter. I kind of covered that a little bit and why I chose this occupation. Well, this conversation should last about 2 to 5 minutes. It's usually going to be right from the waiting room until I bring them back to the room, just so I can explain what's going on while walking them back there and what I'm doing when I leave. And I'm going to demonstrate this actually with a little bit of a script that I wrote. Dr. Hansen inspired this and mentioned it during one of her office hours. Just please be aware my pronunciation isn't great, but I'm going to do my best. So here it goes, the 1-act play of Emily and the patient. Liza Enriquez? Buenos días.
¿Podrías confirmar su fecha de nacimiento?
28 de enero de 2001.
Perfecto, mi nombre es Emily y hoy seré la técnica de salud preparada para el Dr. Chen. Estaremos en este cuarto de examen a su derecha.
¿Te gustaría un transdecta para la vestida de hoy?
Sí, por favor.
Un momento. You guys enjoyed a little of that script. It's very brief as I'm still very new at my Spanish. But beyond just that script, I also made a hot sheet for some of the common terms used in my office at least, and I'll go over a few of those with you right now. So the first word I learned is ojo. This would be used when I'm talking to a patient about a possible head injury that's caused vision loss. Ojos means open your eyes in Spanish. This would be used a lot when I'm helping the doctor with an injection where the patient needs to keep their eyes open. They seem to want to close them during that, or when I'm getting their eye pressure. Here, this is used in a wide range of things that I'm doing. Like when I'm having them read the chart, I can point and be like, aquí, so that they know that's where I want them to look. Or if I want them to rest their chin for a slit lamp exam, I can go like aquí and point to my chin and use my body language to help with the visit so that it's not all reliant on the interpreter. It was critical to my second SMART goal, which was learning 5 new Spanish words relevant to healthcare every time I worked, which was 3 days a week, Monday, Wednesday, Friday. I would write down a word throughout the appointment, such as the ones I just showed you during my interactions, and either during my downtime between patients or after work, I would find the Spanish translation for those words and add it to my little hot sheet. And I actually put all these words in my iPad where I keep notes about how to use certain machines at work so that if we get a new health tech, I can possibly help them learn a few common Spanish phrases at the office. SMART goals relevant to my career. My third SMART goal was to be able to read a children's book in Spanish. I was not able to acquire a children's book during the summer because I just didn't seem to find the time to go to the library and get one, especially with moving out the end of the month. However, Duolingo has these little story components in their language learning. So throughout my regular Duolingo, I would come across these stories and I actively sought them out. And I would definitely say at first I was getting pretty frustrated with them, and I even voiced that to Dr. Hansen during one of our Zoom calls because it was just completely in Spanish and I felt really lost. But I definitely saw that as time progressed, I started to understand these stories a lot more, and I didn't have to click for the translation and such. And it also helped that they were covered primarily by vocabulary that Duolingo had already taught me. I know my Spanish isn't perfect, but I'm really excited to continue learning Spanish and even learning more about the Spanish culture so that I can continue connecting with my patients, and even as a future physician, maybe connecting with some of my employees that are from Spanish descent. And I'm really excited to continue putting this into practice. And thank you guys for watching, and thanks for a great summer semester. Bye, guys.